Are you struggling to regain full knee extension after ACL surgery? Give these a try. The first thing that I'll have somebody do following ACL surgery, working on passive knee extension. What we're going to do is we're going to have the individual prop their heel up onto a towel, a half of a foam roller, and just let the knee sink down. Now, the biggest thing is I want to make sure that the towel or the foam roller is high enough so that my calf isn't already touching the ground to where it's still in a bent knee position. So allowing gravity just to do its job, just stretching the knee out and just having them relax for a long period of time. I prescribe about 4 by 15 minutes throughout the day, so 60 minutes total throughout the day after surgery. Now, if somebody can't tolerate that because of the discomfort in behind their knee, I'll start them off with doing smaller bouts, so 5 minutes at a time, and then just try to work our way up, but making sure that we are accumulating the 60 minutes throughout the day. Now, if somebody is really struggling to get this extended position, what we can do is we can add a cuff weight and put it above the kneecap and just allow that to help assist the knee down into a stretch here. Now, immediately following up the low, long duration stretch, I'll have the individual use a strap to assist them into knee extension. So for this one, my cueing is pull, push, squeeze. So I have them putting pressure above their kneecap. They're pulling up with the strap, getting their heel to lift up off of the floor, and then they're squeezing their quad muscle at the same time. The majority of people have hyperextension in the knee, and we want to make sure that we're regaining it equal to the opposite side. I like to prescribe about 500 reps a day of getting the pull, push, squeeze. This has been crucial in helping people bridge the gap between passive and active extension. Now, the third one that I'll have people do is just a traditional heel pop. Now, what this looks like is similar to the pull, push, squeeze, but now I'm just having the individual try to squeeze both feet at the same time, trying to drive their knee through the floor to get the heel to pop up. From a front view, I'm trying to make sure that my heels and my toes are getting the same height up off of the ground. Now, after surgery, a lot of people struggle with getting that. So what you can do is you could put a towel roll, cuff weight, put it right behind the knee to give the individual some feedback on what they're trying to do, which is to try to drive this knee down. A lot of people will just dig their heel into the ground and squeeze their butt to try to get the extension, but we want to try to get it to where we're actually teaching the individual to press down to get the heel up off the ground. The next one that I like to work on is a terminal knee extension with the band here. But what I like to do with this is not keeping the foot fixed, but rather allowing the foot to move through pronation and supination, the shin to move through tibial internal and external rotation to again help combine those movements as one. So you'll have the individual step through, step behind, but now their foot is forward. Now, if they're right after surgery, you can have them use a crutch for hand assistance. But from here, I'm trying to extend my knee back while my foot is coming into supination. As I shift my weight forward, I'm getting good load through my quad, teaching them that flexed position. My foot is pronated. And then from there, I'm teaching them to push through their foot to again shift their weight back, getting into extension. Go ahead, hit the like button, drop a comment, let me know what you guys think about that.